Clonidine. It stimulates alpha 2A receptors in the brainstem. It acts as a central sympatholytic antihypertensive drug. What does this sympatholytic mean? It means decrease in the sympathetic activity, thereby decreasing the norepinephrine. So the mode of action is alpha 2A receptors auto-inhibit norepinephrine. This clonidine, being an alpha 2A agonist, it increases the activity of alpha 2A receptors, which promotes auto-inhibition of NE, which leads to the decrease in the sympathetic activity. So this decrease in norepinephrine activity in the target site. So normally what happens in the sympathetic activity? So in case of fight or flight response, the heart rate increases, breathing increases, the skin is pale, pupils are dilated, trembling occurs. So this is a picture where you can see what exactly happens in the sympathetic activity. So clonidine acts as an alpha 2A agonist, which decreases the sympathetic activity by autoinhibition of norepinephrine. So this means eventually it results in bradycardia, less cardiac output, decrease in the PP because of the decrease in the sympathetic activity. Because sympathetic activity is responsible for rapid heart rate and breathing, prolonged use of clonidine results in the bradycardia, less cardiac output, less blood pressure. So the pharmacokinetics, this is given orally or transdermally, and the half-life is 8 to 12 hours. Indications. So this drug is used in particular cases. Indications is very important part of this video. So remember this by mnemonic AMC. So under A, we use this drug as antihypertensive drug combination with diuretics and antidiarrheal agent in diabetic neuropathy. And M, we use this drug in migraine and postmenopausal flushing. So prophylaxis of migraine and to decrease postmenopausal flushing. And C, in chronic alcoholics and chronic pain. So in case of chronic alcoholics who are struggling with withdrawal symptoms, we can use this drug. And also in case of acute or the chronic pain. Adverse drug reactions. The side effects of using this drug are sedation, depression, nausea, dizziness, headache and bradycardia, postural hypertension, impotency. Rebound hypertension crisis. This is important. So one should keep in mind whenever we are giving this drug to a patient, this clonidine, sudden withdrawal should not be done. In case of sudden withdrawal, there will be release of excess of catecholamines, which causes nausea, headache, tachycardia, sweating, tremors, palpitations. That means excess of sympathetic activity released, right? To treat this rebound hypertension crisis, sodium nitroprusside is used. And important terms to be remembered in clonidine is it's an alpha 2A agonist, autoinhibition of norepinephrine leading to the sympatholytic activity, which means decrease in the heart rate, decrease in the cardiac output, decrease in the blood pressure. Rebound hypertension crisis is seen in case of sudden withdrawal of clonidine and treated by sodium nitroprusside. Indications AMC, antihypertensive drug, antidiarrheal in diabetic neuropathy, postmenopausal flushing, and prophylaxis of migraine. In case of chronic pain and chronic alcoholics withdrawal syndrome, this drug is recommended. Bye.